The Belize Cancer Center Dangriga was founded to provide accessible and affordable cancer care to Belizeans. Dr. Ellsworth Grant, hematologist and oncologist at the center, says that while the services are now being made available, the Belizean public must also take responsibility for their well-being. He adds that events like the information session help spread the importance of this. The BCCD has also recently launched a pediatric ward to care for children with cancer.
We've picked up a lot of the slack, so to speak, to bring care to those children, and particularly with the leukemic children. And we try to take care of all aspects of their care, whether it's providing transportation, giving them medications, helping the families out with food, recognizing that it's not only a tragedy for the child, but actually a big source of stress on the entire family. So our attempt is to ensure that if kids will pass away from cancer, that they do so not due to access to care, but more because the disease was better.
But the resounding message is that cancer is preventable with early detection and intervention.
You will do better from a cancer if the stage of that cancer is early. And early being stage 1, even a stage 2 cancer sometimes is a bit too advanced. And what we're seeing in our people with stage 3 and 4 cancers. And the battle is much harder and more intense with such a stage cancer, and your chances of surviving a stage 3 cancer is less. Stage 4 cancer, you are treating and offering life extension, but not cure of that individual. The holy grail is always prevention, and the only cancer to date that has a true preventative measure is actually cervical cancer with the human papillomavirus vaccine. And many people still don't realize it, but cervical cancer is a sexually transmitted disease.
Joining in the fight against cancer is the Ministry of Health, which has spearheaded the formation of the National Non-Communicable Disease Commission. Marjorie Parks, Deputy Director of Health Services in the ministry, says the commission has developed a national strategic plan.
The sole objective of this plan is to prevent, control, and reduce the burden of NCDs and their related risk factors. The 4 priority areas targeted for action in the plan are the health promotion and disease prevention, integrated management of NCDs and risk factors, surveillance, data collection, and information dissemination, as well as public policy and advocacy.
Healthy eating is also vital and was addressed during the session. Other risk factors for cancer include obesity, inactivity, tobacco use, and alcohol consumption. Special Envoy for Women and Children, Kim Simplis Barrow, also addressed the forum on issues related to specialized health care services for children. Dalila Ikal for Love News.